Welcome to Medically Speaking. Guest today is Dr. Jessica Cannallatos, Craniofacial Center, Western New York. Doc, thanks for joining us today.
Thank you so much for having me. I'm excited to be here.
Great. I know we want to talk about the Craniofacial Center, the program itself, and some of the impact it has here in Western New York. But let's start with you. Obviously, you're a physician, but if you can, tell us a little bit about your role and your background.
Yeah, sure. So at the Craniofacial Center, I'm a prosthodontist. And as a prosthodontist, I specialize in restoring and replacing missing teeth, often working with patients who have complex dental facial issues. So my training in prosthodontics really has allowed me to provide comprehensive care for these patients. I treat patients birth through adulthood with or without craniofacial conditions, but mostly with craniofacial conditions at the hospital. And it's great on the team because we have a multidisciplinary team. We can all treat these patients with these various craniofacial conditions. So in particular, what I do is I see these little cleft lip and palate babies, and I create nasoalveolar molding appliances, which help shape the gums, the lips, and the nose prior to their surgery. So this is all starting when the baby's just a couple of weeks old. And I make a prosthetic and they wear it for a few months before their surgery. I also do ear molding for babies to correct ear deformities. And also I make speech aids for patients with speech impediments, speech impairments. And I also just make prosthetics for missing teeth. So I have a lab here on site too, which is cool. So I actually make the prosthetic in the clinic. So that's a really exciting thing that I got to add to the clinic.
So you're talking about some very unique and specialized services, but let's take a step back. So for the viewers who are watching, the Craniofacial Center, Western New York, in its role within Oishei Children's Hospital, if you can explain a little bit about what the center does.
Sure. So the Craniofacial Center is dedicated to diagnosing and treating a variety of craniofacial conditions, including cleft lip and palate, craniosynostosis, and other facial anomalies. We use a multidisciplinary approach involving experts from various fields to provide, holistic care for the patients. We have a plastic surgeon, craniofacial surgeon, orthodontist, ENT, speech therapist, just to name some of the key members. And we all work together to provide the best possible care for each unique situation that walks through the clinic.
That's great. I know you guys are affiliated with the new hospital and the program there, but if you can, dating back, I know at Bryant Street, the Craniofacial Center had a role there too. How long has the program or the center been around? And tell us a little bit about its uniqueness in terms of treating patients, because I believe this is really the only place you can go here in Western New York for something like this.
Yeah, that's true. So the center's actually been around for 35 years, and it is unique to the region. A very fun fact about me is that I was actually a patient of this craniofacial center. So
Wow.
my plastic surgeon and my patient care coordinator are actually still on the team. So I get to work alongside these people. Like when I was 7, I had a vision of standing next to my plastic surgeon providing treatment for these patients, and I'm literally doing that now. So it's
Remarkable.
really, really cool. But so as far as the Craniofacial Center goes, it offers specialized care not readily available elsewhere in Buffalo. And thanks to the comprehensive team-based approach and it's unique. We advance treatment through research, education. It is part of a larger network of different centers throughout the United States. There's approximately 180 approved sites throughout the United States, each dedicated to providing comprehensive care for these patients.
So how far will patients come across Western New York to see you?
So it is mostly, it is Buffalo, a lot of Southern Tier patients. There is a team in Rochester, so that's the next closest center.
You talked a lot about the medical and surgical interventions, obviously very important, but what other support resources are available for patients and families when they do have to go through the center and or a procedure?
Sure. So we have, like you said, the surgical treatments, dental, orthodontic care, speech therapy. We do have psychological support as well because it is a lot going through. As a patient myself, I know you could use a lot of support when you're one of these patients. And we have social services as well. Our team approach ensures that the patients receive coordinated care from multiple specialists, all working together. And we also provide educational resources and support groups for the families to help them navigate through the journey. We have an awesome patient care coordinator who provides educational resources. And our network called the ACPA offers a great support for these families. It's the American Cleft Palate Craniofacial Association. Their website connects families also. And in Buffalo, we have an organization called Miles for Smiles, and a lot of the parents meet that way.
So let's talk a little bit more about the Miles for Smiles. What is it? How does it interface with patients and families, and what role does it play within the hospital program?
Sure. So it's a charitable initiative designed to raise awareness and funds for craniofacial conditions. So it includes a wine tasting event. It takes place every summer. This year, it's July 29th at Aqua Restaurant. Anyone can attend. It's a really fun event, and we usually raise about $20,000 annually for the Craniofacial Center. And what the funds do is they help provide medical care, support research, and offer financial assistance to the families in need. So, for example, these cleft lip and palate babies need specialized bottles for feeding because they're unable, to use a normal bottle due to the birth defect. So we supply those bottles.
So you talk about an event in July. I'm sure that's no coincidence. July is Craniofacial Awareness Month. For the viewers who may be watching, what message would you like to get out when we talk about the Awareness Month and the importance of these types of programs?
Sure. So during Craniofacial Awareness Month, it's important to support those affected by craniofacial conditions. They not only impact physical appearance, but also overall well-being. So by raising awareness, we can foster a more inclusive society, reduce stigma, that's a big one, and support research and innovation. So every smile matters, so support can really make a difference.
That's Dr. Jessica Cannallatos, a former patient and now current physician with the Craniofacial Center of West New York. Doc, thanks for joining us today.
Thank you so much.